restoration?
So there are a few potential causes. It could be bacterial, meaning there's still some bacteria left in the tooth.
Okay.
It could be chemical, meaning the patient is sensitive to one of the materials in the restoration.
Right.
It could be thermal, meaning the restoration is conducting heat or cold too easily.
Right.
Or it could be mechanical, meaning the restoration is putting too much pressure on the tooth.
Okay. So it could be a lot of different things.
Exactly.
So how do we figure out which one it is?
So the first thing we need to do is rule out any other causes of pain.
Okay.
Like, is there a crack in the tooth? Is
Right.
there an occlusal discrepancy?
Right.
Once we've ruled out those things, then we can start to focus on the restoration itself.
Okay.
And we can do some tests, like a cold test or a percussion test,
So
to try to pinpoint the source of the pain.
so it's like detective work,
It is detective work.
trying to figure out what's going on.
Exactly.
Okay. So once we know what's causing the pain, then how do we fix it?
It depends on the cause. If it's bacterial, we might need to adjust the restoration.
Right.
Or even do a root canal. If it's chemical, we might need to replace the restoration
Okay.
with a different material. If it's thermal, we can try to insulate the restoration.
Okay.
And if it's mechanical, we can adjust the occlusion.
Gotcha. So there's a solution for everything.
There's usually a solution.
It just takes some time and some detective work to figure it out.
Okay.
Okay. So we've talked about pulpal lesions. We've talked about post-restoration pain. What other challenges should we be thinking about when we're doing operative dentistry?
So I think moisture control is a big one.
Ah, yes. Moisture control, the bane of every dentist's existence.
Exactly. Because if you don't have good moisture control,
Right.
your restorations are not going to last.
They're going to fail.
Exactly. And you're also increasing the risk of sensitivity
Right.
and recurrent decay.
Gotcha. So how do we make sure we have good moisture control?
So the gold standard is the rubber dam.
Yeah, the rubber dam.
It's not always the most popular thing.
I was going to say not the most patient-friendly
Yeah.
necessarily.
Like, it is the most effective.
Right. Okay, but I know that sometimes the rubber dam just isn't practical.
Yeah.
Like, what are some other things we can do?
So if you can't use a rubber dam,
Right.
then you need to use a combination of other techniques like cotton rolls,
Right.
suction,
Yeah.
and even just good communication with your assistant.
Right. Right. Teamwork makes the dream work.
Yeah.
Okay. So moisture control, definitely important. What else? What else should we be thinking about?
So I think gingival retraction is another important consideration.
Ah, yes, gingival retraction.
Because if you don't have good access to the margins of your preparation,
Right.
your restoration is not going to fit properly.
Right. It's going to be open to all those bacteria and everything.
Exactly. And it's also going to be more difficult to get a good impression.
Right. Right. Okay, so how do we retract the gingiva? Like, what are our options?
So the most common method is to use retraction cord, which is basically a piece of string
Right.
that's impregnated with a vasoconstrictor.
Gotcha. So it pushes the gums out of the way?
Exactly. It temporarily shrinks the gums
Right.
so you can get better access.
Okay. But I know that there are other techniques too. Like, what about lasers?
Yeah, so lasers can also be used for gingival retraction,
Okay.
and they have some advantages over retraction cord. Like, they're less traumatic,
Yes.
and they can be more precise,
Gotcha.
but they're also more expensive.
Right. Okay. So it's a trade-off.
It is a trade-off.
You have to weigh the pros and cons.
Exactly.
Okay. So moisture control, gingival retraction,
Yeah.
all very important.
All very important.
What else should we be thinking about when we're doing these operative procedures? I mean, it sounds like we have to think about a lot.
We do have to think about a lot, but I think that's what makes operative dentistry so challenging.
Right.
And so rewarding.
Yeah. That's like a puzzle. You have to figure out all the pieces
Exactly.
and put them together.
Yeah.
And I guess that's why we need these deep dives
Yeah.
to remind ourselves of all the things that we need to be thinking about. Okay. Well, I feel like we've covered a lot of ground here. Is there anything else that you want to touch on before we move on to our last section?
I think we've covered the main points,
Okay, great.
but, we could talk about this all day.
Oh, yeah. There's so much more to discuss.
But I think we should save some for next time.
Okay.
Okay.
Let's do it. Let's take a breath,
Yes.
and then we'll come back and wrap things up. Okay. So we're back, ready to wrap up our deep dive into cariology. And I think it's only fitting that we end with infection control
Yeah,
because it really ties everything together.
absolutely.
And it's so important
Yeah,
for
yeah.
everything that we do.
It's the foundation of everything we do.
So let's start with the basics.
Yeah.
What are the key principles of infection control in operative dentistry?
So I think the most important thing is to break the chain of infection.
Okay.
And that means we need to identify the sources of infection, right? The modes of transmission
Right.
and the susceptible hosts.
Okay, so it's like we have to think about all the different ways that infection can spread
Exactly.
and then try to block those pathways.
Exactly. So, for example, we know that saliva and blood can be sources of infection.
Right.
So we need to wear gloves and masks to protect ourselves from contact with those fluids.
Right. And we've talked about moisture control, too, which
Yes.
is kind of like another aspect of this.
Exactly. Moisture control is essential.
Yeah.
Because it prevents the spread of saliva and blood.
Okay. So we've talked about personal protective equipment. What about sterilizing our instruments?
Yeah, so sterilization is another critical aspect of infection control.
Right.
We need to make sure that all of our instruments are properly sterilized before we use them on a patient.
And there are different methods of sterilization, right?
Yes. There are a few different methods, like autoclaving, dry heat, and chemical sterilization.
Okay. And how do we choose which method to use?
So it depends on the type of instrument. Some instruments can be autoclaved,
Right.
while others need to be sterilized using dry heat or chemical solutions.
Okay. So it's important to know which method is appropriate for each instrument.
Exactly.
What about things that can't be sterilized, like impressions?
So for items that can't be sterilized,
Right.
we need to use a high-level disinfectant.
Okay. And are there different types of disinfectants?
Yes, there are a few different types, and each one has a different kill time.
Okay. So we need to make sure we're using the right disinfectant
Yes.
for the right amount of time.
Exactly.
Okay. So we've covered a lot of ground here today.
Yeah.
From the basics of cariology all the way to infection control.
It's been a great deep dive.
It really has. And I think it's a good reminder that as dental professionals,
Yeah.
we need to be constantly learning and evolving
Absolutely.
to provide the best possible care for our patients.
I agree.
So any final thoughts for our listeners?
Just keep learning, keep practicing good infection control,
Yeah.
and keep striving to be the best dentists you can be.
Well said. Thanks for joining us on this deep dive.
Thanks for having me.
And we'll see you next time.